Welcome to Big Blend Radio, where we celebrate variety and how it adds spice to quality of life. Welcome, everyone. Today, I'm very excited to have Dr. Marschall Runge back on the show. We first met him with his thriller called Coded to Kill, a techno-medical thriller. And that really kind of gave us a heads up on the advancement of medical technology. And actually, that's what we're going to talk about today. But we're going to just touch base and on his new book that is out now. It's called The Great Healthcare Disruption, Big Tech, Bold Policy, and the Future of American Medicine. His books and all the information you want to know is at drmarshallrunge.com. The link is in the episode notes. But Marshall, welcome back. How are you?
I'm good. It's great to see you, Lisa, and thank you for having me. Thank you for having me back on your show.
I know you're really busy with this book, doing tours and speaking events, and I think it's about time someone wrote what you have written. But I also think that it's really interesting thinking about Coded to Kill, because here you are, a doctor, a cardiologist, a dean of medicine, and then you wrote a novel that is killing people. And now you're saving them with your next book, which is nonfiction. Right. But you're looking at both sides, and I think it all goes to getting people to be aware, right? No matter which way you're writing.
Right. Yeah, and healthcare has so much to offer, and it has so much to be careful about.
Yeah, so give everyone, just before we get into the new book, an overview of Coded to Kill, just so they can get a little teaser of that.
Well, Coded to Kill is a novel. It's, the great thing about novels is you don't have to fact check. You can make up anything you want. It's okay.
To be freeing as a doctor, right? And also do, all the university work and all of that. So that's got to be kind of freeing.
Yes, absolutely. It's great fun. In Coded to Kill, there's a fictional hospital named Drexel Hospital in North Carolina, and they have developed what's going to be the world's greatest electronic medical record. And it's going to connect people across the United States. It's going to have AI. It's going to have everything that you can imagine, including genetic profiles, and it'll be easy for people to find if there's another COVID-19, it'll pop up and be easily recognize. Lots of things that people talk about in terms of a national electronic medical record. But as it turns out, there are people who are behind the scenes, and they're looking at that as a great data source. So not only can they hack into it and dig up dirt on anybody they want, so if there's a politician they don't like, they can find terrible secrets in the electronic medical record, but they also are experimenting with determining whether they can use the electronic medical record to kill people. So as you know, there's what's called the Internet of Things. It's how everything is connected to everything these days electronically. And so it is, and my IT experts tell me, while theoretically possible, they don't think it's really possible. But it would be possible for a crazy person, a doctor, nurse, whoever, to crack into the electronic medical record and then to instruct, for example, delivery of a lethal drug to a person that maybe is allergic to it. And so they're thinking of not only can they use the EMR to dig up dirt, but they can use it to kill people at a distance. And so there's the protagonists who are trying to figure out what the heck is going on. People are dying and they don't understand why. And the antagonists who are just on the verge of getting through politics is getting this electronic medical record declared the national standard. So who will win? You have to read the book to find out.
Well, okay, so then how does this tie into the new nonfiction book? Because you are talking about these kinds of things, the great healthcare disruption, again, big tech, bold policy, and the future of American medicine, because things are changing, and for a lot of it being really good, but there is so much fear about technological advancements. Records is one. Data is a huge thing right now. I mean, it's whether, maybe there's so many class action suits on cell phones and all kinds of things right now that I'm wondering what's happening in the medical system. So Coded to Kill kind of touches on this in a little bit, right? In reality.
It does. And maybe it's more than a coincidence that I wrote about that as fiction, and I had the opportunity to write a nonfiction book, which was also really interesting. And I learned a ton about technology and its potential and its perils in healthcare. And frankly, I had a chance to take a deep dive into areas in healthcare where we could be doing a much better job. Before jumping right into technology, I'll just give you a couple of examples. I think everyone knows that healthcare in the United States is pretty expensive. What you may not know is if you look at the cost of healthcare per capita in the United States and compare it to all of our similar countries, countries that are relatively wealthy and educated, the cost of healthcare in the United States is by far the highest. But when you look at preventive health and being healthy, and a big part of that is having access to primary care providers who can help you in this journey so you don't end up in the hospital. The number of primary care providers per capita is just the opposite of the cost. So if you look, the cost, we're way high. The number of primary care doctors per capita, we're the lowest of any of them. And, you think, well, how did that happen? And there are lots of reasons that has happened. Part of it is that the emphasis on very highly specialized care in the United States, which I do think is terrific. But part of it is that we just haven't had an emphasis on health. And I personally have grown to believe that if there's one thing that can save us from the cost of healthcare in the United States, it's us being healthier and not having to go to the emergency room or not having to go to the hospital. Or if we have to, we're a lot healthier when we get there. So it's not as complicated. But there's another interesting aspect of life in the United States. Epidemiologists calculate what they call the healthy average life expectancy. So that is, in any country, how long do people live a healthy life? So I'm not talking about if you're totally debilitated, but that's total life expectancy. But how about if you're healthy and you can do what you want to do, you're mentally intact and you're physically intact? When that is looked at, the United States, this is going to shock you, shocked me, ranks 60th in the world, 60 in the world in healthy life expectancy. So there are 59 countries where your chance of living longer and healthier is better than in the United States. And these same models show that if we don't turn things around, by the year 2050, we could be 120th in the world. And it's because of chronic disease, really. It's because of this huge wave of obesity and diabetes and all the problems that diabetes carries with it. It's also due to the problems that have been rampant in the United States around opiate misuse and alcohol misuse. So there's some things that we could do that are not easily done. And I'm hoping that people will read this book, The Great Healthcare Disruption, and think, well, I need to take better care of myself.
Yeah.
When I speak about it, that's what everyone tells me. I spoke about it yesterday in Houston. I'm in Dallas today. And one person came up to me afterwards. I said, I think it's really important that you exercise a certain amount, and the general amount that's quoted is a half an hour a day, at least 5 days a week or more. And it doesn't have to be running a marathon. It doesn't have to be, getting on your Peloton and outdoing all your Peloton friends, but it's exercise. Walking is fine. And this person said, well, that's just not right. And I thought, oh my gosh, what's he going to tell me? And he said, I exercise 3 hours every day. I swim 3 hours a day. And I thought, wow, can you imagine? I'd be a prune if I swam three hours one day.
Yeah, no.
But he told me he had not been in great health and he had injured himself. He couldn't really jog. He could walk. And so he has thrown himself into making himself healthier.
That is huge. It's about really taking that proactive change. And I think sometimes we need to have community to help us make a change. So friends do it together.
Yes, absolutely.
Walking groups in your neighborhoods, which is really good for safety and community. And I think that part of our health issues in this country is that we drive everywhere. We have food choices that are just like crazy. And I think that it's like almost the worst food for you is the cheapest food. Let's just be straight up. And the people who really need healthier food are the ones battling financially. So I think it goes with our food system. It goes with this lifestyle of get it quick, get it now. And I kind of also feel it's like maybe get more into a community mindset that could actually help in as a whole. Hey, we all want to have healthier vegetables. Well, I know neighborhoods, as you know, we travel the country full time and we're in actual communities. So we're seeing a lot, and we're seeing it's really kind of nice to not be living by a TV screen of what they're saying is going on in the country, but actually be out there. And I see neighborhoods where people are sharing the bounty of their garden with each other. Oh, we got all these grapefruit. Let's share them down through the community. And I think that's a way where, I don't know, it's like everybody's trying to do better. And I see like the Blue Zone Project going through communities across the country. And that's part of going with the healthy ones that are the 60 above us, that are beating our butts in health. But then what about technology now? And I'm seeing things like there's some advancements in preventive help health in regards to doing scans. Like, I don't know any woman that really enjoys getting their mammogram done, but from what I've heard, there's some advancements now in mammograms, and there's advancements in these tests that we all really don't want to do. We don't. Sorry. So are those some of the things that could also help us in prevention?
Yes. And at least before I go into that, I just want to say much of what you said is if you look at people who are writing about or have studied longevity, and there's a lot of interest in people living longer lives. You hit on several of them. Healthy, you have to eat healthily. You have to have community and friends. And that part of, you don't necessarily think that that's a big part of health, but that is a big part of health. And one of my favorite quotes was from a recent book by who had 5 principles, and one of them is fitness and exercise are not optional. And that I think is so important. And you talked about food choices. I know I'm leaning off what you said, but in Singapore, which is one of the world's healthiest countries, they heavily tax junk food, highly processed food, and they use the money from those taxes to make healthy food more available. They also have a walking environment so that they do all kinds of things to encourage people to walk rather than to drive, including having incredibly expensive driver's licenses or car registration licenses. So you hit on 4 of the 5 principles. The only one you didn't hit on is sleep, which I wouldn't have thought about, but regular sleep, going to bed at about the same time, getting up at about the same time, and sleeping the amount that you need. And everybody eats a little bit differently, whether it's 7.5 hours or 8.5 hours or more or less. That also is a great predictor of health. So we got through all the predictors of health. I'm happy to talk now about technology, but since you were on all of those topics, I thought
I know, I just got all excited. Well, because it feels like there is hope. And I think with your book, you're showing that and some of the pitfalls too, right? So it's a little bit of everything because I think everyone's complaining and we don't really understand what's going on. And then we get into prescriptions and technology and medication being astronomical. And so
Right.
I don't even know what's going to happen now with, people getting their medicine from Canada. I mean, people were
Right.
doing that, right, in Mexico. And right now with tariffs and all kinds of political drama, it's going to change things again. I think, things like what Mark Cuban is doing.
Yeah.
Doesn't that help in a way with those kinds of things? And he's using technology, isn't he, in a way
Yes.
to boost things?
So, yeah, that's a great place to talk about technology. So Mark Cuban, who is from Dallas or lives in Dallas, I think.
Yeah, we're on a Dallas streak here. Yeah, but I don't know if we're allowed to eat as much, beef. I don't know.
Oh, yeah, that's my Achilles heel with Texas. I grew up in Texas, but barbecue and Southwest Tex-Mex food is rampant here, and it's not good. But
It's good,
Cuban,
but it's not good for too much of it.
So Cuban has developed his own company for making mainly generics, but he's going to branch out into other drugs. But what's incredible about it is that they're using technology to make these medications less expensively. They're using medications that are well known. And then the way they price it is it's cost plus 15%. And that is so different than the way it works in general, where a pharmaceutical company may make a medication at the same cost. They do have a price inflation, but then it goes through several steps that makes the medicines cost 3 times as much as they cost to produce. And we're suffering from that. I think I do talk about Cuban's cost plus pharmacy approach because in the book, because I think it's powerful. And I think we'll see more of that.
And it's
You're right.
transparent.
And it's totally transparent. AI, so a topic these days is how important AI could be or might not be in healthcare. And you mentioned getting mammograms and other kinds of tests that AI could, or you didn't mention the word AI, but that AI could be helpful in. And I'll start at an extreme. There's some people who say, we won't need doctors and nurses anymore because we'll have AI bots. I absolutely do not believe that, nor do I want to have an AI bot to be my doctor or my nurse. However, AI can present data in a very clear way, and it can analyze all kinds of things. So, for example, AI has turned it out to be very good at image analysis. So mammography is an imaging technique, so MRI, and so is having a CAT scan. And although it's not yet quite proven to my satisfaction that AI never misses anything, what it's very good about is finding normals. And so if you think about your mammogram or you think about a CAT scan, you may have 15 or 30 images. And if a radiologist knows that the only ones they really need to look at are images 6 through 8, that saves time and allows them to pay more attention to those specific images. Meanwhile, there's studies going on with AI and what I'll call data aggregation, meaning what's your genetic profile? How should that be incorporated into understanding imaging? Because taking mammography again, there are some women who have little calcified spots. That's just part of their being. It doesn't necessarily mean that those are a prodrome to breast cancer. And so AI can help providing some of that information as well. Now, a great radiologist knows those things, but I think the more information we have that can be aggregated in a way that's understandable, the better.
And so it saves time. And then I've heard also about countries using this in different medical systems, hospitals and things, using this kind of sourcing of information, research and data sourcing, that it actually takes away the tedious amount of admin work so that, small clinics and things like that can actually focus on the patient more than the actual admin stuff. Is that true?
That is, I'll tell you, there are already some great applications, off-the-shelf applications of AI, and one is just what you talked about. So it's called ambient AI. And if you're like me, the last few times we've gone to see our doctor, I don't know if the video shows up also, but the doctor's typing on the computer over here and looking back at you every once in a while. And the reason is they're trying to document your medical record and document everything that you say. And it's distracting for them. And for a busy practitioner, they can end up at the end of the day with a couple of hours worth of documentation they have to do. Wow. So all this increase in documentation came in with electronic medical records. And there's some positives, but it's a time sink for all healthcare providers, not just doctors, nurses, physiologists, pharmacists, you name it. What ambient AI does is quite amazing. So if you and I are having a conversation, we'll make you my doctor and I'm the patient. It's listening to everything that we say. And at the end of our encounter, it produces, it's not a transcript. It's a really great AI note, which is a medical note. And you as my physician would have to read it, make sure it's accurate, and almost always it is. But it's like other things that you might do with AI. I don't know if you do, but if I ask it for a little summary of something, it does a great job with that.
Yeah.
And so in this case, it not only frees up you and I to have a normal conversation and really connect as a patient and provider, but it also takes, when you're done with seeing me, you're done. You don't have another 15 minutes to deal with at the end of the day to try to write a medical note about it. So that technology is out there. It's available. We recently started using it at the University of Michigan, at Michigan Medicine, and I have yet to meet, and about 1,000 doctors are using it right now. I have yet to meet anybody who doesn't say, wow, thank you. That is so great. And it's an example of AI. There's another great example there's a hospital in Houston. I was just in Houston yesterday, one of the Methodist hospitals in Cyprus, which is a suburb of Houston, that they've made a digital AI oriented hospital, smaller hospital. And so they are using a technology that watches surgery. Mm-hmm. You're a surgeon now, Lisa. So you're performing a surgery, and it knows that when you put in your last stitch, that it's approximately 15 minutes before I will arrive in the recovery room. And so that enables the operating rooms to be used more efficiently. But what I think is the best part of that is if you have had, we all have had friends or family who are having an operation that's tense, you're sitting there thinking, when are they going to tell me something? It allows a very clear communication to friends and families that your loved one will be in the recovery room in 15 minutes or 20 minutes. And it is able to put that together by looking at lots of different data and bringing it together.
On an app on your phone when someone's in, I mean, it's like they all have it. It's like you can keep up with your follow-up visits, your medications, you can which gives an empowerment to the patient or the family.
Yes, absolutely. You said it better than I did. I should just be quiet and let you say it.
No, I'm the surgeon, remember? But this is so exciting because it does, sometimes you get like a booklet of paper and you don't know where to read what it is, but you can actually follow up and know what happened, because like you said, the emotions are there, but you have something to fall back on and do some further research. But the emotions, it's stressful for the patient. And then the medical industry is sometimes worse, than the actual medical issue. It's hard.
Lisa, you touched on another really cool thing that AI can do. So I don't know if you or friends or family have requested your medical records, but if they're so thick, so much information is thick, if you ask for it. They put it on a CD or sometimes on a USB drive. And if you try to read it, it's a great sleep medication. And you can't make heads or
Or you
tails of
get horrified by the
Yeah,
terms and you go, oh my God, I'm dying. And you might
right.
not be, you know, we're all dying.
If you take that and make a PDF of it, of your entire medical record, and feed it into your favorite AI uh, device, I like ChatGPT, and say, I'd like a 3-page summary of my entire medical record. It'll give you a really good 3-page summary. Another thing that's really confusing is figure out what do all the doctors think I'm on in terms of medication. So you say, tell me what are my current medications and what I should never take again. And it'll print it right out for you.
Wow.
And it's a powerful technology.
I think you could probably use it even for, you know, we talk about obesity, about what your intake is, you know, because I know
Yes,
this. My Nana used to always say, if you are wondering why you got a few extra pounds, start writing down every time you put anything into your mouth, you
right.
know. But now we have apps, and that's the other thing, apps to check everything, right?
Yeah, I haven't ever used any of those diet apps, but I hear they're very good that you just snap a picture of whatever it is you're eating and
Uh-oh.
it keeps all that. Yeah, I'm afraid to do it, to tell the truth.
Yeah, especially while you're in Dallas. I mean, in Texas.
Right,
But
right.
well, the other thing going on this weight thing, this is something I've noticed that really across the board that, and I know people doing it, and I keep going because I remember, you know, as a teenager, there were all these get, you know, thin real quick and all these things you should do, shouldn't do. Everybody has like, oh, go on a detox, go, you know, and I always think anything extreme is could be probably not good for your body, but I don't know anything, but I know how to cut your leg off because now I'm a surgeon. Thank you. But I'm seeing all these people take obesity medications, injections. I don't know any, like, well, the names and everything. I think I can't pronounce them. Let's just put it that way. Are these things good? I mean, is this something, I mean, from what I've heard from cardiologists, you're a cardiologist, and, you know, pretty much any issue in our body is when we start putting on weight. It affects all kinds of things, right? Asthma, if, you know, I know that if I go over a certain weight, whatever my breathing issues will start to come back because now you're making your body work overtime. So are these things legit? Because there used to be stuff out there, and then it's like, if you did this, you're actually speeding up the heart rate. You're like, those things were really bad. So where are we on what's going on? Because I was raised like, don't touch any of this stuff. It's bad.
Right. Well, Lisa, I think that's a great question. In fact, I have a chapter in the book that's mainly about obesity. So if you think about it, if you look at the rates of obesity over the last 25 years, they have skyrocketed such that nearly half the population of the United States is obese now. And you don't have to look around very far to see that. And you're absolutely right. Everything that's associated with obesity in terms of medical problems is problematic, whether it's diabetes, whether it's sleep apnea, whether it's joint problems, needing joint replacements. So I want to tell you about these drugs. So they're called GLP-1 agonists. So what that means is there's an enzyme called GLP-1 that is related to, it was thought to be related just to appetite. And the thought was that if you have more of this than you normally have, that will make your food pass more slowly through your stomach. And most people who have been on these drugs will say that if you're not careful, they make you very nauseated because the food's not going anywhere in your reflux. But the newer drugs are better about that. And if you start slowly. But what was found is really fascinating. So they actually started out as diabetes drugs. And one of the markers for diabetes is this marker called hemoglobin A1C. It's a reflection of your long-term levels of glucose in your blood, sugar in your blood. So it has found that those drugs are better than any other drug in bringing down your hemoglobin A1C. And it's your hemoglobin A1C that correlates so tightly with all the problems of diabetes. But then it turned out that they were great for weight loss. And then it turned out that it's not just food passage, that they're interfering with a system in the brain that generates dopamine. So dopamine is one of those hormones. It's sort of the fight or flight hormone. So you get scared to death, dopamine goes up. You have some other kind of stress, dopamine goes up. And it's not as well known, but if you eat sweets, dopamine goes up. If you
If
eat
you
junk
win the
food,
lottery, dopamine goes up.
well, that's
how,
true too.
Isn't this how casinos and video games on your phone, they use
Oh,
that?
absolutely. So it turns out that dopamine, these dopamine surges, you're right, are very related to addictive behaviors. So it's not just eating. And if you're like me, my problem is it's really addictive eating at night. I just had trouble shutting it off. But it's not just food consumption. It's alcohol, it's cigarettes, it's gambling, it's narcotics, and it's sleep apnea. It turns out all of these areas are now being studied, and these drugs are now approved for multiple indications. And in fact, the American College of Cardiology, which is one of our national organizations, just last week published an article recommending that these be primary prevention for people at risk of heart disease because they do so many good things. So this is truly a unusual class of medications that I think has the potential to really change things in a very good way in the United States. I remember early in the current administration hearing one of the leaders say, it's all about clean food. If we just get people clean food, they'll be healthy. Meanwhile, Elon Musk, who is obviously well known, part of the administration or was part of the administration, said, I think these GLP-1 agonists, we should make them available to everybody at a low price. Currently, they're pretty pricey. And that would go so far and the speculation is he's used one himself. He used to be a lot bigger than he is now. And I found that fascinating because he was willing to come out and say that. And I think that has been the experience. So not every drug is like that. There are several drug companies that are now working on making these in a pill form that I think a lot of people are more amenable to a pill form than taking a shot once a week. They're an example of the newest class of drugs that are coming along. And one of its great benefits is in drug design. So I'll give you one last example and then I'll stop my soliloquy here. The general amount of time it takes to develop a new drug is years. If they're drugs that the pharmaceutical companies think are hitting a very important topic, but they're hard to find, that can take much, much longer. I was on the Eli Lilly board at the time. They did this experiment where they took an undruggable target they thought was very important. They said would have taken 100 medicinal chemists about 3 years to find a drug that would work. Took all the information they could about similar drugs, similar targets, put it into AI. I mean, it's more complicated than that, but they developed an AI algorithm. And it took so much computer power to shut down the Google computer farm in the Midwest temporarily because it was using up all the capacity. But the result was in 3 days or 5 days, some short period of time, they had 5 potential new drugs. And they were going through the process to look at it. And I think 2 or 3 of them looked like they were doing exactly what they were designed to do. So in the course of 2 or 3 months, finding these compounds, making them, and then testing them, they had taken what has taken
Decades.
years or decades and come up with drugs. And most importantly, I think AI will enable us to really test those drugs in the right population. So rather than having to have a study that costs $1 billion and has 1,000 people, probably can be done with 300 or 400 people that have the right genotype and the right other characteristics that would make this drug feasible. So I'm very, very enthusiastic about seeing the future of AI. I'll call it AI-enabled drug development because there are lots of diseases that we don't have good medications for.
Well, if you look at, we've got some things coming back like was it yellow fever that came back or measles?
Measles and yellow fever.
Yes. Yeah. And so we've got, and I think as our climate changes, I think disease is going to change. That's just my own personal opinion since I'm a surgeon. And,
I think you're right. You're not.
Yeah,
Right.
I think we're changing, right? And so it's changing the environment. And so plants are changing. We're finding species that have been there that maybe we didn't see before. I've been talking to biologists on the animal side going, well, if it's changing them, it's sure going to be changing us humans, right? So this is fascinating to me to be able to have all this data. I go back to the pandemic of how fast we had, these vaccinations, right? And so I know that's a tricky topic for people, but I was like, well, this is a little fast, but then you've got to think that the Obama administration were actually working on that before, and they knew something was coming down the pipeline. But do you think if we had, because we all know these things come throughout life, right? Another kind of pandemic, which people pretty much say there's going to be one, this could help having AI to create something to help if there's another pandemic, or at least track how the viruses morph and the viruses are crazy things, man. That's weird stuff.
I think you're, again, absolutely on target. So one thing I will say is that the development of these new vaccines that was one of the great accomplishments of the first Trump administration. So now they have people in his administration who say no vaccines are bad, but Project Warp Speed, I don't know if you remember that, that was done when Trump was president, and it really was warp speed in developing these vaccines. I will be unambiguous about saying those vaccines saved millions and millions of lives, and the number of complications related to those was very small in comparison. In fact, I've canvassed the literature. I can't find any death associated with the COVID-19 vaccines. So I think it's pretty unambiguous. But what made that possible was AI and a new way of developing vaccines. So a vaccine typically takes 10 years to develop and test. And one thing that was different, I will admit, is these weren't tested to the same degree they would have been had it been customary vaccine development. But they used a technology called RNA technology, which enabled these vaccines to be developed in months instead of a decade and to be highly effective. Just speaking of that technology, RNA technology, that has since been used since the COVID to treat some genetic diseases. So it's genetic therapy. In children, there are a host of childhood illnesses that are totally genetic. They're due to a mutation in one gene or another. They're rare. They may affect only 2 or 3 or 4,000 children a year. But if one of those children is yours, it's devastating because they can't live. They develop all kinds of problems. These RNA vaccines, now there are 3 or 4 of them that are approved and on the market, and they can fix that disease by replacing the mutated part of a gene. It's just mind-blowing how this happens. They replace that. And so the total experience of these new RNA therapies is about 10 years because they've been studied in people for about 10 years, and they're incredible. There's another RNA approach that's for children who have hereditary hearing loss, and it's just amazing that this RNA genetic medicine approach will restore hearing or enable hearing.
So is this connected to how stem cells work, or is that 2 separate modalities?
Two separate modalities. Stem cell biology is also fascinating. And now not just any stem cells, but stem cells can be tailored to what your particular problem is. So it's a bold new world out there in medical therapy. And I do think it's right to look at these new therapies with some degree of skepticism and make sure that they're not just a lot of hype. But we have now a number of examples that are really could not have been imagined.
So we're actually feeling a little bit better, right? I mean, I know I touched on this last time we spoke, but the other part of it is the financing, the money that goes into healthcare. And everybody's arguing and carrying on. And it's like, okay, of course, prevention is good, but there are issues. I mean, I have some good friends who are the healthiest people I know, and they died way too young. Like just you're in shock, like what happened. So I know genetics had to do with some of it. It wasn't, and they did everything they could to be healthy. But so I wonder about this future of where we're going, because not everybody can afford to go get tested. Not everyone has free ability to go to mammograms. And right now for women, women's health is, really controversial. And sometimes I feel like we're getting big purple stamps on things, or red stamps, or whatever stamp color you want on something, but it's this broad brush. And what you're talking about, it seems to be where things, AI and technology, are allowing things to be a little bit more tailored. Like you don't say, okay, this person has heart disease, so you take this blood pressure pill, you take that, without having an exam and knowing, well, you may want to take this pill instead of that, because each body is different. Everybody has a different makeup. So what about being able to get access to all of these things? How do we fund all of this? I think what Mark Cuban is doing is fantastic, but will AI help to bring costs down in some way, somewhere, because of it being able to speed things up a little bit? Will it be a tool to help us actually be able to afford something? Because I think we have a huge problem in this country in regards to people not affording healthcare.
Yeah. Well, Lisa, I think you're asking 2 related questions. And one is, can these new approaches for drug development that'll be more tailored, can they reduce costs? And I think they can. And it's your example that you gave about heart disease is a perfect one. Not everyone is going to benefit from certain medications. So if we can more accurately figure out who will benefit, particularly on expensive medications, that's a benefit. But I also think that, and I have a chapter about this in the book, we have to be realistic and about how there are significant inequities in access to healthcare. very significant inequities in the United States. And so what's the solution to that? Well, I think part of the solution is to look at other countries who do so well. They're in the top 10, not in the bottom 60 in terms of healthy average life expectancy. And so they have something we don't have. And it's vastly misconstrued and misrepresented in the press. So what most of them have is some level of government-sponsored healthcare. It's not the blue plate special. It's not everything that you can get with private insurance, but it's baseline healthcare. And so Denmark gets a lot of credit for this. So does Singapore, so do a number of other countries. But what is the reality is that it's not just the government healthcare. That covers a baseline, gives access to everyone. People that want to have a higher level of personal touch or healthcare buy supplemental insurance. So you never hear about it when people talk about Denmark and their great socialized medicine, but 40 to 50% of people in Denmark also buy supplemental health insurance.
Yes.
My thought about it is that we should think seriously about that. And I'm going to give you two personal examples of that. For years, although not in recent years, just because I couldn't find the time to do it, I would go to a health clinic that is a government-run health clinic. There are many of these. They're called Federally Qualified Health Centers, QHCs. They benefit from government support, and they are available to anybody. You can walk in that door, whether you have insurance or don't. They have patients with insurance. They have patients with no insurance, patients with Medicare. They take care of everybody. And they're based around what's called a medical home model, where there are doctors. It's primary care based. They're doctors, they're nurses, they're therapists, they're pharmacists. They have their own drug supply there that you can pick up your medications. Most have dental care. Some have ophthalmology cameras. And so I worked in this. They wanted me to come there every other week or so to provide follow-up for cardiac patients who've been in the hospital and to do stress testing, which I did both. And it's inspiring to see the people who work there. They're there for all the right reasons. And it's inspiring to see how they promote this medical home such that people can, if I'm go to one of these clinics and I'm sick today, I'm sick right now, as soon as we hang up, I can go over to the clinic and I'll get taken care of. Now, tell me where you get that kind of access elsewhere. People give the government programs a hard time. That's one example. Another one, and VAs, I think, similarly, although they get a bad rap from time to time, they really deliver excellent health care. My other example was last summer I went to I don't know if you've been to Shiprock, New Mexico in your travels.
Yes.
Beautiful place. It's on the Navajo Nation, and they have health care as part of the Indian Health Service. It's still called the Indian Health Service. And so I had the opportunity to go out and spend time in Shiprock at a Indian Health Service health center. And it was all primary care, although they had 60 inpatient beds. And it's 99% tribal members. You have to be a tribal member. You pay zero. The pharmacy's right there. You get your medications. Anything you need, you get there. If you have something more complicated and you need to see a cardiologist, you go to a regional cardiology hospital and it's paid for. And the result is that the health care that the tribal members get is unbelievable. But more important than that, the doctors who work there, and it's, as I said, primary care, it's family medicine, it's pediatrics, it's general medicine, it's OB. Those people, they get paid a good salary. They're not going to retire and buy an island off of that, but they get paid a good salary. But they are so dedicated to what they do. And they're smart and they trained at good places. And honestly, Lisa, it was inspiring to me. Sometimes I get kind of burnt out thinking about healthcare, but they are an inspiration. And at that particular site, the most recent people who joined 7 years ago. But they had people who'd been their physicians for 25 years. And as I said, they trained somewhere from the University of Michigan, some were from Johns Hopkins, some were from Duke, they were from great places. I think we can do this. And I think if we can get beyond all the hyperbole about this and that, some of these.
Well, here's my thing on this. We do so much work in tourism and speaking on that. And recently we were in Oklahoma and doing a conference, and I talked about the building of tourism and responsible tourism. And I go from the park side, right? As you know, we document parks and public lands. And I've done so many interviews to a point of I look at what's happened to communities that are impoverished, that do not have the funding, and it feels like they're just keep getting pushed back, right? So then, and they don't necessarily have the funding for healthcare and for insurance and things like that, then it is okay, now we're going to a government program. Everyone wants to cut the government programs. But these communities also get slighted in regards to having an urban park, to having trees. So a community will often go in and beautify the beautiful places that people all have money. It's like, oh, let's put an extra fountain here. Meantime, our neighbors down the road don't get that. And so when you don't have shade and you don't have plants, you have dust, you have what's going on in the air, you have pollution, and they're the people getting sicker, right? And so I always talk about in tourism, if you want to boost your economy, you need to look at what your community needs and have the input from your community. So you don't have like, oh, okay, if the community that doesn't have a park suddenly gets one, it's going to be a positive for a traveler coming through town who's going to drop money in and boost your economy. So I look at that same thing, that if a community looks at where are the areas that really need improvement, because it's going to affect health. Now, travelers don't want to go to a place that's toxic. We don't want bad air quality. We don't want all those things. We want a shade tree and sit underneath it and, hang out with your dog or whatever. It goes in the same thing. Can't we look at health as and preventive health, like actually putting in these parks? Because I know that we all need a park between 8 to 10 minutes from our house to actually make these positive changes, to calm down. The stress factor is real in this country. The phone screen time that we have, we're actually disengaging from community. And that was what I was, when we first started talking, I was talking about communities. Go walk in the park with your friends every morning. That way everyone actually does it. You call each other and get your butt out of bed. You know what I mean? We have a commitment here and we're all going to do it. That's why mall walkers do so well, So I'm thinking this in communities, can't we look at it in that way? And I'm sure a lot of people do, but that if we rise up our communities on the small grassroots level, right? That if our community starts to get healthier, that we will actually change the economics, because doesn't health actually help? Like, I was not going to say health is wealth, but it is, right? Personal. But if our communities of people are healthier, doesn't that benefit the economy than where we are at right now? And also just calm everybody down a bit, because when people are sick, they're not happy and then they get crabby. So I just kind of look at this whole thing as like from a bird's eye view going, well, if people are healthy and their communities are healthy, I just see that to be an economic betterment.
Yeah, I think that's brilliant. Seriously, we ought to collaborate on a next book.
I won't cut your arm off because you need to type.
Yeah, please leave your surgeon persona behind. But
really.
No, these things are so interlinking: health and community, and the things you just talked about. And I haven't studied them and I certainly haven't seen as many as you have, but it seems like I've seen communities where people have come together around exercise and around
community gardens.
Gardens. Yeah. And, I think that's fantastic. I don't think I mentioned this to you. Tell me if I'm repeating myself, but in Singapore, which gets ranked so highly, did I tell you about the tax on ultra processed foods?
Oh yeah. You said that they jacked those up. So that's kind of the thing we could do.
And then they use the money to buy.
The same as liquor and marijuana goes up in certain places, right? And cigarettes, that's what we've done in this country. And didn't that smoke? Okay, so can we change what's going on with vaping and all of that and like, hey, eye that out? Like those kinds of things. Yeah, I think we've got some big lobbies that are still going.
We do. And, it's, we live in, and I think we all benefit from that. We live in a society where things that you can do commercially have good, but they sometimes have bad. It depends on what it is. But I think bringing these concepts to people and helping them understand. One thing I'm trying to do is part of the reason I'm on this speaking tour is to promote the book, but part is to try to engage with people so that they'll engage themselves. The Great Healthcare Disruption is written not for CEOs of health systems. It's written for people, and for them to be able to look and understand some of these forces that are going on with their health and healthcare. And in the same way, when you're speaking to people at national parks or local parks or in communities about the importance of community, it's the same thing. It's just part of the same spectrum.
I think it's just we're also everything that's going politically and globally. I mean, there's just a lot of stuff going on in the world, and we get tied up in that. And there's so much heat over that that sometimes we forget to go just next door to your next door
Right.
neighbor. But we see a
Right.
lot of that, and we see people come together. And joy comes from unity. So I think that's
Yes.
a big part of it. But before you go, I don't want to close on a negative note, but are there negatives to all of these great innovations, all the AI, the stem cells, the pills so that I can lose my, holiday eating that I'm still feeling? I know it's summer, but I'm in trouble. But now I feel like I'm going to go walk a dog now. That's a good
Good.
thing.
Yeah.
It's a healthy thing. But are there negatives that people should be aware of with all of this? In other words, okay, use AI, but double check it. You know what I
Yeah.
mean?
Yeah. I'll make a couple of comments. First is I think AI has lots of potential benefits, but it also has problems. And you need to think carefully about how you're using AI. I'll give you one terrible example. I think AI is pretty good in terms of providing facts. But when people get into a conversation with AI as if it's a friend, uh, AI doesn't have empathy. It's not a friend. It's just putting back to you what it thinks you want to hear. And the most recent example I saw, fortunately, wasn't a tragic example, but it was published last week or two ago in the New York Times about a guy who was using AI for spreadsheet preparation. And he got talking to the AI and somehow or another got led down this rabbit hole where AI had pretty much convinced him that he lived in the Matrix, like the Matrix movies, and that he was Neo. He was the chosen one, and he had magical powers. And finally, he bounced out of it and said, "Whoa, wait a minute." I think if those kind of interactions with AI, people have to be particularly careful about. But I think it's always good to double check what you hear from AI. I think
Well, that's even
additionally,
with humans too, though. You
yeah,
should
well,
have a
that's true.
second opinion's not bad either. Yeah.
Yeah, absolutely. Um, the second comment I'd make is that although the FDA gets criticized about screening new medications, new vaccines, et cetera, the FDA is a first-class organization. And what I encourage people not to do is there is so much commercialization and advertising about things that have never been tested. Some of the, multi vitamin combinations or new nutraceuticals or whatever
Mm.
that people will tout and say, look at me, I'm so healthy. I've been using product X. Most of those have never been proven. So I would urge caution that if you're thinking about a new medication or a new approach, look first to see if it's been really strenuously tested. People will argue with that and say, oh, that's not right. The FDA screens out all these things, but it is right, in my opinion.
I think testing is good. I mean, I'm a surgeon. I can cut off arms and legs. Now we're just doing all limbs now, but I wouldn't know about testing drugs. You know what I mean? It's like I think, they did that in the 60s though. I'm just kidding. But I think it's so exciting about this book because I really believe it's needed because we just need a clear voice. And I think everyone when we go to a doctor, we want to sit down and ask them all these questions that you've written. So it's really great there. Go out an audiobook for people too.
Yeah, I'll tell you what, we got an audiobook going a couple of weeks ago, 3 weeks ago, and it is very popular because a lot of people listen to audiobooks. And in fact, I was doing this talk I was doing yesterday. Somebody came up to me and they said, I love the audiobook. And I said, oh, really? It's about 5 hours. The reason I was particularly intrigued about that is I don't listen to a lot of audiobooks myself, but it's a Forbes book, may choose among 10 different readers. So they're all different styles. And so I got myself and a couple of family members and some friends, and we listened to all these. And our consensus was a single person. So we chose that person. And the person who told me how much they enjoyed the audiobook yesterday said, and your reader was fabulous, not too hyperbolic, easy to understand, spoke very clearly. So
Awesome.
yes, there is an audiobook. It's available.
drmarshallrunge.com is the website, and you can go to Amazon, all those great places. But don't forget to get Coded to Kill so you can learn about how to stay healthy, but then how things can go awry, right? Get the novel as well. So did that get an audiobook for the novel?
No, not yet, but now I'm thinking about an audiobook.
I know. You got yeah, you never know. So I like that. I like that. Well, thank you so much for joining us. I know you're on a busy circuit, so it's a real pleasure to have you back on the show while you're so busy. It's like, thank you.
Well, thank you, Lisa. It's great to talk to you. I've always enjoyed it. Always learn a lot. I learned not
Thank you.
to give you too many surgical powers, so I'm a little worried about that.
Yeah, I know, but you still have your head. We'll talk about getting headless in the desert in another episode, and that's when we're going to talk about Marshall's next books.
Yeah.
All right. Well, we'll leave you headless in the desert for now, but keep your head on because you got a lot of work to do. All right, Marshall.
Thanks, Lisa.
Thank you for listening to Big Blend Radio. Keep up with our shows at bigblendradio.com.